Welcome. Today, we're diving into the world of temporomandibular joint disorder, commonly known as TMJ disorder. This condition affects the jaw joint and surrounding muscles, often leading to discomfort, pain, and even difficulty with basic activities like chewing or speaking. TMJ disorder is more common than you might think, and understanding its triggers is the first step toward effective management. In this video, we'll explore the most common causes and risk factors that can set off TMJ symptoms, helping you recognize what might be affecting your own jaw health. Let's begin by understanding what TMJ disorder actually is. The temporomandibular joint, or TMJ, is the hinge that connects your jawbone to your skull. It's located just in front of each ear and allows your jaw to move up and down and side to side, making it possible to talk, chew, and yawn. When this joint or the surrounding muscles become irritated or inflamed, it can lead to TMJ disorder. This disorder can cause a range of symptoms, from mild discomfort to severe pain and restricted jaw movement. Understanding the anatomy of the TMJ is crucial for recognizing how various triggers can impact its function. TMJ disorder is a broad term that covers pain and dysfunction of the jaw joint and the muscles controlling jaw movement. Symptoms can include jaw pain, clicking or popping sounds, headaches, and even earaches. The severity and duration of symptoms can vary greatly from person to person. Some people experience only occasional discomfort, while others may have chronic, debilitating pain. Recognizing the signs early and understanding what can trigger these symptoms is essential for effective management and prevention. One of the most common triggers for TMJ disorder is stress. When we're stressed, we often clench our jaws or grind our teeth, sometimes without even realizing it. This constant tension puts extra pressure on the TMJ and surrounding muscles, leading to pain and inflammation. Stress management techniques, such as relaxation exercises, mindfulness, and regular breaks, can help reduce the impact of stress on your jaw. Being aware of your stress levels and how they affect your body is a key step in preventing TMJ flare-ups. Bruxism, or the habit of grinding or clenching your teeth, is a major contributor to TMJ disorder. This often happens during sleep, making it difficult to control. The excessive force exerted on the jaw joint and muscles can cause pain, stiffness, and even damage to the teeth. If you suspect you grind your teeth at night, a dentist can recommend solutions like mouthguards to protect your jaw and teeth. Addressing bruxism early can significantly reduce the risk of developing TMJ disorder. Physical trauma to the jaw, such as a direct blow, accident, or sports injury, can damage the TMJ or surrounding tissues. Even a seemingly minor injury can lead to long-term problems if not properly treated. Jaw injuries may cause misalignment, inflammation, or even dislocation of the joint, all of which can trigger TMJ disorder. If you experience jaw pain after an injury, it's important to seek medical attention promptly to prevent chronic issues. Arthritis, particularly osteoarthritis and rheumatoid arthritis, can affect the TMJ just like any other joint in the body. These conditions cause inflammation, pain, and deterioration of the joint cartilage, leading to TMJ disorder symptoms. People with a history of arthritis should be especially mindful of jaw pain and stiffness, as early intervention can help manage symptoms and prevent further joint damage. Misalignment of the jaw, also known as malocclusion, can place uneven pressure on the TMJ. This can result from genetics, injury, or dental issues such as missing or crooked teeth. When the jaw doesn't align properly, the muscles and joints have to work harder, increasing the risk of TMJ disorder. Orthodontic treatments, or dental adjustments, can help correct misalignment and relieve symptoms. Believe it or not, your posture can influence TMJ health. Poor posture, especially when sitting at a desk or using electronic devices, can cause the muscles in your neck and shoulders to tighten. This tension can travel up to the jaw, putting extra strain on the TMJ. Maintaining good posture and taking regular breaks to stretch can help reduce the risk of TMJ symptoms related to muscle tension. Extensive dental procedures, such as prolonged mouth opening during dental work, can sometimes trigger TMJ symptoms. Holding the jaw open for long periods can strain the joint and surrounding muscles, especially if you already have underlying issues. If you notice jaw pain after dental visits, let your dentist know so they can adjust their approach and recommend preventive measures. Certain chewing habits, like frequently chewing gum, biting nails, or chewing on pens, can overwork the jaw muscles and put stress on the TMJ. Over time, these repetitive actions can lead to pain and dysfunction. Being mindful of these habits and reducing unnecessary jaw movement can help protect your TMJ from unnecessary strain. Your sleep position can also influence TMJ health. Sleeping on your stomach or with your hand under your jaw can put pressure on the joint, leading to pain and stiffness in the morning. Try to sleep on your back or side with proper head and neck support to minimize unnecessary strain on your jaw. Hormonal changes, particularly in women, can play a role in TMJ disorder. Fluctuations in estrogen levels may affect the ligaments and tissues around the TMJ, making them more susceptible to injury or inflammation. This may explain why TMJ disorder is more common in women, especially during certain life stages like pregnancy or menopause. Genetics can also play a role in TMJ disorder. If you have a family history of jaw problems, arthritis, or connective tissue disorders, you may be at higher risk. While you can't change your genetics, being aware of your family history can help you take preventive steps and seek early intervention if symptoms arise. Certain connective tissue disorders, such as Ehlers-Danlos syndrome or lupus, can increase the risk of TMJ disorder. These conditions affect the strength and flexibility of ligaments and joints, making the TMJ more vulnerable to injury and dysfunction. If you have a connective tissue disorder, regular monitoring and gentle jaw exercises may help maintain joint health. Chronic inflammation in the body, whether from autoimmune conditions or ongoing infections, can contribute to TMJ disorder. Inflammation can damage the tissues in and around the joint, leading to pain and limited movement. Managing underlying inflammatory conditions and maintaining a healthy lifestyle can help reduce the risk of TMJ symptoms. In rare cases, infections in the jaw or surrounding tissues can trigger TMJ disorder. Bacterial or viral infections can cause swelling, pain, and even abscesses that affect the joint's function. Prompt treatment of infections is crucial to prevent long-term damage to the TMJ. Overusing your jaw, such as talking for long periods, singing, or playing wind instruments, can strain the TMJ and surrounding muscles. If your lifestyle or profession involves frequent jaw movement, it's important to take breaks and practice relaxation techniques to avoid overuse injuries. A diet high in tough, chewy foods can put extra stress on the jaw joint. Foods like bagels, tough meats, or hard candies require more forceful chewing, which can aggravate TMJ symptoms. Opting for softer foods and cutting food into smaller pieces can help reduce strain on your jaw. Cold weather can cause muscles to tense up, including those around the jaw. For some people, exposure to cold air or sudden temperature changes can trigger TMJ pain or stiffness. Keeping your jaw warm with scarves or masks during cold weather can help prevent discomfort. Emotional factors like anxiety, depression, or chronic stress can increase muscle tension throughout the body, including the jaw. Emotional well-being plays a significant role in TMJ health, so addressing mental health concerns can help reduce the risk of TMJ symptoms. Some medications can cause side effects that impact the TMJ. For example, certain antidepressants or stimulants may increase muscle tension or cause involuntary jaw movements. If you notice new jaw pain after starting a medication, consult your healthcare provider for alternatives or adjustments. Some people with TMJ disorder experience episodes where their jaw locks open or closed. These episodes can be triggered by yawning, wide mouth opening, or sudden jaw movements. Jaw locking is a sign of joint dysfunction and should be evaluated by a healthcare professional. TMJ disorder can sometimes cause symptoms in the ears, such as ringing, fullness, or pain. These symptoms may be triggered by jaw movement or changes in pressure. If you experience ear symptoms along with jaw pain, it could be related to TMJ disorder. Headaches, especially tension headaches, are a common symptom and trigger for TMJ disorder. Jaw muscle tension can radiate to the temples, forehead, or neck, leading to persistent headaches. Managing jaw tension can help reduce headache frequency and severity. The muscles of the jaw, neck, and shoulders are closely connected. Tension or dysfunction in one area can easily spread to another, making neck pain both a symptom and a trigger for TMJ disorder. Regular stretching and posture correction can help break this cycle. Consistently chewing on one side of your mouth can overwork the TMJ on that side, leading to pain and dysfunction. Try to distribute chewing evenly to avoid putting too much strain on one joint. Dental appliances like braces, retainers, or dentures can sometimes alter your bite and put extra stress on the TMJ. If you notice new jaw pain after getting a dental appliance, consult your dentist for adjustments. Contact sports or activities with a risk of facial injury can increase the likelihood of TMJ disorder. Wearing protective gear like mouth guards can help prevent trauma to the jaw and reduce the risk of developing TMJ symptoms. As we age, the cartilage in our joints, including the TMJ, can wear down. This natural aging process can make the joint more susceptible to pain and dysfunction. Staying active and maintaining good joint health can help minimize age-related TMJ problems. Dehydration can reduce the lubrication in your joints, including the TMJ. This can lead to increased friction, pain, and stiffness. Staying well hydrated supports overall joint health and can help prevent TMJ symptoms. Smoking can negatively impact joint health by reducing blood flow and increasing inflammation. Smokers may be at higher risk for TMJ disorder and slower healing after jaw injuries. Quitting smoking can improve overall health and reduce TMJ symptoms. Caffeine is a stimulant that can increase muscle tension and contribute to teeth grinding or jaw clenching. Limiting caffeine intake may help reduce TMJ symptoms, especially if you're sensitive to its effects. Alcohol can relax the muscles, but it may also increase the likelihood of teeth grinding during sleep. Additionally, alcohol can dehydrate the body, affecting joint lubrication. Moderation is key to minimizing TMJ risks associated with alcohol consumption. Seasonal allergies can cause sinus congestion and inflammation, which may put extra pressure on the jaw and TMJ. Managing allergies with appropriate medications and avoiding triggers can help reduce TMJ discomfort during allergy season. A sedentary lifestyle can contribute to muscle weakness and poor posture, both of which can increase the risk of TMJ disorder. Regular physical activity helps maintain muscle strength and joint flexibility, supporting overall jaw health. Excess weight can increase inflammation throughout the body, including the jaw joints. Weight gain may also contribute to sleep apnea, which is linked to teeth grinding and TMJ disorder. Maintaining a healthy weight supports joint health and reduces TMJ risks. Chronic illnesses such as fibromyalgia or chronic fatigue syndrome can increase sensitivity to pain and muscle tension, making TMJ disorder more likely. Managing chronic conditions with medical support can help minimize TMJ symptoms. Deficiencies in certain vitamins and minerals, such as vitamin D, calcium, or magnesium, can affect muscle and joint health. Ensuring a balanced diet with adequate nutrients supports TMJ function and reduces the risk of pain. Dehydration can reduce the lubrication in your joints, including the TMJ. This can lead to increased friction, pain, and stiffness. Staying well hydrated supports overall joint health and can help prevent TMJ symptoms. Hormonal medications, such as birth control pills or hormone replacement therapy, can influence TMJ health by affecting the ligaments and tissues around the joint. If you notice changes in jaw pain after starting hormonal medications, discuss this with your healthcare provider. Certain jaw exercises can help strengthen the muscles around the TMJ and improve joint function. However, overdoing exercises or performing them incorrectly can trigger pain. Always follow professional guidance when trying new jaw exercises. Facial tics or involuntary movements can put extra strain on the TMJ and surrounding muscles. If you have facial tics, working with a healthcare provider can help manage symptoms and protect your jaw health. Dental crowding or misaligned teeth can alter your bite and put uneven pressure on the TMJ. Orthodontic treatment may be necessary to correct alignment and relieve TMJ symptoms. In summary, TMJ disorder can be triggered by a wide range of factors, from stress and jaw injuries to hormonal changes and lifestyle habits. Recognizing these triggers is the first step toward prevention and effective management. Maintaining good posture, managing stress, practicing healthy habits, and seeking professional care when needed can all help protect your TMJ and improve your quality of life. If you experience persistent jaw pain or dysfunction, consult a healthcare provider for personalized advice and treatment options.